Hello everyone, it's Melissa Sweet here, public health journalist from Croaky. We're a few days out from IH May Day 18, the Indigenous Health Twitter Festival founded by Dr Lynore Geia. Here we are sitting in the Palm Island Aboriginal Shire Council with the Mayor, Mr Alf Lacey, talking about stepping out into our future. What does that mean for you?
Well, for me, it means that we build, for our future generations. That's what it means to me. But not only for young people, but for people who are middle-aged, but our elders too, because they always had a vision. I always believe that when the people were sent here 100 years ago, they didn't just settle and think that they didn't have a future. There was a vision that they passed on to their children and families. What do you think, Matt?
Yeah, look, I think in terms of, I think first and foremost, and carrying on from what Lynore was saying, is that there has been a vision from, I suppose, the start of Palm and to where we are today. And I think the important thing in the journey that I've been on for the last 20 years, particularly being involved in all that aspect of community life here on Palm, is the issue around us taking control of our health, which is really important. And that's why we've embarked on, from a community point of view, and we look at history in terms of the health system in our community, and whether we have input or whether we don't have input. I think the important thing is that if we're to determine our health outcomes in the future of the next generation, health outcomes, then they need to be in the driver's seat and not sitting in the back of the bus. And that's why we embarked very strongly on the Palm Island Health Action Plan, working collaboratively with Queensland Health and Commonwealth Health in terms of saying to them, well, if the gap isn't closing in a lot of our communities and our stats are still high, then think of a different model that'll allow our people to have input. We don't need to be the experts in it, but let's give some direction in terms of where health and what would health look like in the next 100 years for our people here on Palm. And I think the only way we could do it is to be the drivers of it, because I think it's really important where if our diabetes are so high, our hypertension, heart disease are high, we're now becoming more vulnerable to being on dialysis machine. Our lifestyle has changed from back then to now, and we're not living longer because that generation has slowly disappeared in terms of living to the 80s or 90s, which most of those elders have moved on. And I think we owe it to the next generation to ensure that, look, whilst we put good public infrastructure here on Palm, but the important part of with good public infrastructure and with good decision making for this community is that also saying to our people is that we want you to step up and also be a part of your health outcome, because it's your individual choice. And being part of the Health Action Plan now for the last 10 years has been certainly something really rewarding from where I sit, because it was people like Ivy Sam, Erica Kyle, Beryl Carsters, Stumper Walsh, Sylvia Rubin. Most of those people are not with us now, but they were the people that certainly kept me on the straight and narrow in terms of, whilst we can fix up our other issues in our community, it was important that, health had to become also that important aspect of our community. And I think it's, we're never going to fix everything, but I think the journey's already now started in terms of our people having more opportunities and more say in terms of policy arrangement, policy development, our health determinants around what's important to this community. And that's why I've been pleased actually as the Mayor here on Palm to actually play seriously in that space. We've trialled some other stuff before. Turtle Dreaming was a classic example in terms of a health model for Palm, and it's just unfortunate it wasn't right for the time. And but we've embarked on a new journey, I suppose, for this next generation now, and that is to, have a say in health. And I think with the goodwill of both the Commonwealth and the state, the development of the new primary healthcare centre in town, which will then move to a community control model. I think it'll give us more of a say in terms of the next generation. They may close the gap in their time, you know.
Can you tell us a little bit about this new primary healthcare centre?
Look, it's been a journey. I was talking to Tony Mooney, actually, who's the chair of the Townsville Health and Hospital Services, and Kieran Keys. Kieran was around in those days. I was come across it accidentally, actually. I was 18 years of age, and only Ivy and quite a few of the elders were in Townsville in the old mall, actually, and they said, we're heading up to the health department, which used to be in the old North Town building. But we need some more Palm people to come to it. And I said, it's not my kettle of fish. You guys are the community leaders that now you're coming with us. So we went up and, they were pretty strong actually in terms of what they wanted. I can see the passion and what they wanted to realise in terms of having some control over health in our community. And, because the local health system on Palm was, as we all know, was tagged as the Panadol Hospital. So every time you went to the hospital, even for very serious matter, you were walked out the door with Panadol in your hand. And I knew those old people knew that wasn't what we wanted here on Palm. And I think the thing that particular meeting, and it was years ago actually, that really gave me the passion. And I said to myself and promised myself that if I ever got elected to the council, because I was young then, wasn't a councillor at that time, but some of the ladies who were there were councillors at the time. That if I ever get elected to the council, that I'll keep the commitment in terms of influencing, I suppose, or enabling council to steer in the department, and particularly the health department, in a new direction in terms of health outcome here. The fortunate thing, which sort of made it easier for us, is that Yarrabah got in first, which was one of its first, I think, in Queensland for dogged communities, which we're called. Were able to get the community controlled health centre up, and we've embarked on that journey and kept on knocking on doors and sitting down having conversations. So it's just good to see now that the $16.8 million primary healthcare centre being now built on the island. Council has entered into some agreements with State Health, with the eventual, in a few years' time, the eventual gradual takeover by the community. So in the long run, we will see that the health centre on Palm will be in community hands, and that's where it should stay, And that's the primary healthcare stuff. It's not the acute stuff. We said to health, you have the acute stuff because you're good at doing that, but at least give us give us control over the front end, so we can have our people to have input, have a say, and even just guide, whether they're experts or not, in terms of guiding where the community would go. And I think, like I said earlier on, is that we may not close the gap in our lifetime, but the next generation may close the gap in their lifetime.
And speaking of the next generation,
he's sawing away here. But having also Palm Island professionals, I would love to see registered nurses, doctors, physiotherapists be back here, working in community in the primary healthcare centre. And that to me is just making our future, taking, as Alf was saying, having our own self-determination to lead the way in health. And that's really important. It's been going on for, over 50, 40 years here in Australia. And I think what's happening on Palm is reflective of what's happening nationally too, with the Uluru State, that they're stepping out forward too for our own national voice. But I know that Palm is having their voice as well within the state of Queensland, and it's really good to see. And our youth have always had a really soft spot for our youth, and I think they're the leaders that we need to encourage and grow now, and they're the ones that will change.
So can you tell us who you are cuddling there, Lynore?
Oh, this is my grandson, Tyberius.
And for Tiberius's future, you've talked about
Tiberius's
self-determination, you've
Yes.
talked about stepping up now. What other things would you like to see
I'd
to help
like
create
to see
his future?
Tyberius be able to be a strong Aboriginal man, be able to step forward in the world, knowing his culture, knowing his identity as a Bulgaman boy, Bulgaman man, and to pursue whatever career he wants to pursue, and really to be, when he has his own children, to be a good father, to have be able to lead his family. That's all I want. I don't expect him to go to university or anything like that. Just expect that all I want for him is that he is able to grow and be sound in his life, and to walk forward strong as a Murray man with his family. Yeah.
Now, we have IH May Day 18 happening on Thursday. We know the Mayor can't join us because he has other commitments. Would you like to send a message to everyone who's participating in this national event, which has been co-hosted on Palm?
Yeah, look, I thank Lynore for her efforts, and I think importantly it is about all of us, and I think I'd encourage our people and our non-Indigenous friends to support and put their support behind it, because I think it's really important that these are the conversation we need to have, not only as Black Australians, but also as a nation, and as Queenslanders. We need to have this conversation and remind both government and non-government that if we are to close the gap for our people, then we need as much participation and support as possible, because self-determination, as Lynore said, is about us sitting in the driver's seat and driving the bus, and I think that's really important. And I wish everyone well on the day, and certainly when it comes to health, I'm always giving 100%, if not more, in supporting new ways of doing things. And same old doesn't work. We need to explore whether it's through our university system or through our communities that is there a better way of doing things. And I think eventually I think we'll get there, and certainly the next generation of this community will have a better lifestyle compared to when I was growing up, and I think it's really important that we need to embrace it, and certainly be a part of the move for change, I suppose, when it comes to it. And things like the Uluru Statement and are really important, because it is about us determining where we need to go. But certainly I'd like to wish everyone well, and encourage everyone to jump on board and support it, whether if it's going all around the world, and our friends around the world jump on board and join it.
Thank you. Lynore, is there any final comment you'd like to make? What's your wish for IH May Day?
To promote and to show the strength of my community, my home, Palm Island, but also to reach out to other communities, because I know there's lots of strong communities out there, and it's not all about us. We're in this together. It's First Nations people. We just happen to be here on my home on Palm Island, but my hope and my wish is that we're all in this together, to walk forward together, as a First Nations people, but also for Australia as well, to close that gap between us that still exists. Okay.
Thank you both very much.